Hi everyone, Jeremy and Dr. Wilson here from Phoenix International Stem Cell Clinic. So, as you can see, we didn't ring each other earlier today before we left the house, and so we're both in blue. But if you guys like that, if you guys like that, comment. We'll be matching every video, okay? Right. But today we're here to talk about why we choose to use what's called adipose-derived stem cells, which those are the ones that you get out of fat, rather than the traditional bone marrow stem cells that you find in bone. Dr. Wilson?
So, simple question, there is a simple answer, and that is that in adipose tissue there is a whole ton more. We have lots more stem cells available for harvesting, and that is the simple reason. So, if we look at bone marrow aspirate on an average sample, they're talking about between 1,000 and 3,000 cells. So let's say on a good day, between 3,000 and 5,000 cells per milliliter aspirated. Some places in the world it's legal to treat the patient beforehand to try and make a culture, and that can double to about 10,000 cells per milliliter. With adipose-derived, with no treating the patient beforehand, you just take the cells out and you take them out and test them, you're going to find around 1 million stem cells per milliliter. So adipose is it's so much richer in its stem cell harvest that it is just a no-brainer for us to offer the vast majority of our patients an adipose-derived stem cell treatment.
And it is important to us say that the stem cells for what we use are, of course, great to get them out of fat stem cells, but they're not quite the same, the stem cells you find in bone marrow versus the stem cells you find in fat. You did a great explanation of this before in the webinar we did. Can you explain exactly what the difference is?
So when we look at bone marrow aspirate stem cells, we're actually going to get a mixture of mesenchymal stem cells, which are the stem cells which you find in fatty tissue, but you're also going to get hemopoietic stem cells. And hemopoietic means that these stem cells will actually have a tendency, or they're the progenitor cell for blood. So those are the cells that help us to grow red blood cells, white blood cells, platelets, all those things that we need for our immune system to work and our blood system, but they are of no use for the musculoskeletal system. Whereas in adipose-derived stem cell mixture is only mesenchymal stem cell. And that means that the mesenchymal stem cell then is the progenitor cell for fatty tissue, muscle, bone, and cartilage. And that is exactly what your body needs when it's trying to regenerate and regrow a musculoskeletal problem.
Perfect. And so the next thing comes, why mixed messages? Why do some people say that fat stem cells not good, bone marrow much better? Why the mixed message?
So again, I think I'm going to split that into two. The first answer is that bone marrow stem cells have been around for longer. Not, of course, in the human body. We've had those stem cells from as long as humans have been around. But in terms of the medical ability to take them out and do something with them. So first, when people talk about stem cell, we thought bone marrow. And actually, originally, most of the stem cells we talked about when I was a medical student, and that's not that long ago, 10, 15 years ago, they were talking about hemopoietic stem cells. So, we can use these stem cells to help people who have leukemia. We can help these people who have other blood diseases. As time moved on, they started to take these and look for mesenchymal stem cells, and there is more research. So the body of research for bone marrow-derived stem cell aspirates is larger. However, that gap is closing because adipose-derived is such a much more high quantitative and qualitative, as far as we can see, treatment that the research now, the new research, is coming up behind. And that's the other reason for why it's not being recommended by some people, is because it's so new that we don't have, the 10-year body of evidence. Or if we were to look at other treatments, some treatments we've had for years and years and years. In this case, these are both new treatments, but stem cell from adipose-derived tissue is actually much shorter lived. It's much newer onto the scene. But if you ask me for my opinion, I would actually say that the research suggests that it is the more potent and it's probably the more correct treatment. So we tend to prefer it.
Yeah.
We tend to offer it as our primary resource for stem cells, simply because it's such a good musculoskeletal treatment.
Yeah, exactly right. So to cut a long story short, people believe in bone marrow just because they've done it for longer. It's more accepted, it's a little bit more popular, and this is new. And even though it's fat-derived stem cell, it's newer, the body of evidence is getting better and better. But again, it's just like when human beings change from horse and carriage to cars, it's something new. People aren't used to it and tend to approach it with a degree of skepticism. And it seems to take about 17 times more evidence to get people to change their original opinions to go onto another one than it took for them to get their original opinions in the first place. So exactly like I said, when we in university learned that bone marrow was where you found stem cells, we typically didn't question it. They just accepted that as fact. And so it took a degree of us seeing and being proven that you could find it for us to accept it as well. So,
but it's a useful treatment if you have problems with joints, back, pain, muscle, in your musculoskeletal system. So your muscle pain, back pain, joint pain. Let us know if you have a question. Comment down below, and we'll answer the questions. That's what this series is all about: answering your questions. And if you want to get in touch with us, you can do that as well. You can book an appointment. And you'll find us on both YouTube, Facebook, and our website, which is phoenixstemcell.eu.
It's a good point, and it's really important to mention that you can do telephone consultations with us. So if you go onto our website, phoenixstemcell.eu, and you click on the link, there'll be links to telephone conversations with us. So then you can we can do an individual consultation with you, and without you having to fly into Norway. Okay, but otherwise, enough from now. You guys have a great day.
Bye bye.